Low-fat milk represents a unique nutritional profile that addresses multiple pathophysiological aspects of gout simultaneously. The protein content, primarily casein and whey, provides all essential amino acids without contributing to the purine load that drives uric acid production. This is particularly significant because protein malnutrition can compromise overall health, yet high purine protein sources like organ meats and certain seafoods exacerbate gout symptoms. The mechanism by which low-fat dairy products reduce serum urate levels involves increased renal excretion. Research published in leading rheumatology journals demonstrates that milk proteins, particularly casein and lactalbumin, promote uricosuriah, the excretion of uric acid through urine. This effect appears to be mediated by specific milk proteins that enhance the kidney's ability to clear uric acid from the bloodstream. Calcium content in low-fat milk serves dual purposes. Beyond supporting bone health, which is crucial since gout patients often have compromised skeletal integrity, calcium may play a role in reducing inflammatory responses. The mineral composition of dairy products creates an alkaline environment in the body, potentially counteracting the acidic conditions that favor uric acid crystallization in joints. Vitamin B12, abundantly present in milk, supports neurological function and red blood cell formation. For gout patients who may need to restrict other B12-rich foods like certain organ meats, low-fat milk becomes an essential alternative source. The bioavailability of B12 in dairy is excellent, ensuring adequate absorption even in individuals with compromised digestive function. Epidemiological studies have consistently shown an inverse relationship between dairy consumption and gout incidence. Populations with higher dairy intake demonstrate lower rates of hyperuricemia and fewer gout attacks. This protective effect appears dose-dependent, with benefits increasing as dairy consumption rises to moderate levels. The low-fat specification is important for several reasons. Full-fat dairy products contain saturated fats that may contribute to insulin resistance and metabolic syndrome, both of which are independent risk factors for gout. By choosing low-fat or skim varieties, patients obtain the protective proteins and minerals while minimizing metabolic stress. This consideration is especially relevant since gout frequently coexists with obesity, hypertension, and cardiovascular disease. Practical implementation should emphasize consistency rather than excessive amounts. Regular daily consumption of 1 to 2 servings of low-fat milk or equivalent dairy products appears sufficient to confer protective benefits. This can be incorporated through direct consumption, in smoothies, with whole grain cereals, or in cooking applications. For individuals with lactose intolerance, lactose-free low-fat milk provides identical benefits without gastrointestinal distress. The protein composition and mineral content remain unchanged through lactose removal processes. Plant-based milk alternatives, however, do not offer the same urate-lowering effects unless specifically fortified with similar protein profiles. The research supporting low-fat milk for gout management is robust and consistent across multiple studies and populations. This makes it one of the few dietary interventions with strong evidence-based recommendations in clinical gout management guidelines. Healthcare providers consistently recommend dairy integration as part of comprehensive gout treatment protocols.